All right, good morning, everybody. This is Nancy Sasaki. I'm the Executive Director at Alliance Healthcare Foundation. Thank you so much for joining us this morning on the webinar for the Innovation Initiative. I'm excited to get started, so we're going to go ahead and begin to talk about what is innovation. Well, let's see. Why won't the slides change? All right, what is innovation? It is systemic change. We're looking for projects that are impacting a broader cross-section of our community. They look at bringing systemic change and most likely are working in collaboration with others. It's not necessarily always the case. We have a couple of our projects that are a single organization. We know that there's a confluence of factors that are happening out there, including less money and more people in need. So what we need to do now is to be able to provide for the people that we're trying to serve. This innovation prepares for the future by doing something different. I think some of you have heard me talk about how this whole project came to be, and that was that when the Affordable Care Act was coming down the pipe, people were saying, wow, we're not going to have enough providers, we're not going to have enough facilities, we don't have the capacity to kind of treat the influx of people that will be coming. And so this was created to tell the community, well, tell us now what you're trying to do and what you think will work to be better prepared for the day that it starts. The project, the Innovation Initiative, is really much broader than the Affordable Care Act, as you can see by most of the projects that we have funded, that we're really looking for that kind of systemic change, though. What are you doing now to prepare for the future? And what are you doing now that can make a really big difference in the lives of the people that you're trying to serve, especially as it impacts cost, quality, and or capacity? Many times we see that using data to support the idea is a really important factor. One of the other projects that influenced the board at the time was a project that was happening out in Camden, New Jersey. We referred to it as hotspotting. It's a project where Dr. Jeffrey Brenner just looked at the data that Medicare had and realized that he could narrow down where in his community the most calls for emergency room pickups were happening, and could identify which of those calls were unnecessary. And he started a project that helped to serve the people in those two areas and greatly reduced the number of ER visits, as well as saved millions of dollars for the community because people were no longer inappropriately using the emergency room. No technology involved other than just reviewing the data. So innovation may or may not involve technology. Where must it affect? It does. Our two-county area of San Diego and Imperial counties are the counties that must benefit from the work. But what has happened in the past, and sometimes what happens, is that the organization may actually not be located here, the headquarters or the main area, but they do have to do the work here. Typically what we've also found is that if this organization is outside of the two-county area, they must partner with an organization that's based in one of the two counties in order to ensure that you have a local champion. That's proven to be very important in some of our projects. The qualifications in terms of where this project how this project can be qualified to be an innovation initiative: must be a 501c3 or use a fiscal intermediary that is a 501c3. Partner in San Diego and Imperial counties, as I just mentioned. We do look for these projects to be fully implemented in 3 years. That has not always been the case, but it is looking at, does your plan allow for you to be at implementation phase in 3 years? We do look for an evaluation component, and it must be innovative. As I go into the application process, some of this is pretty straightforward, but we are going to ask for the usual demographic data of your organization. Your mission statement helps us to ensure that your organization is in alignment with our mission to advance health and wellness. So you'll see kind of that same information that you'll be doing in the application. We ask a little bit about some of your financial information, infrastructure type questions. The percentage of indirect expenses is based on your organizational budget. We don't have, there's a lot of talk right now about overhead expense. We just like to see that as a measure. If it's high, inordinately high, we might ask you about why that's so, but it is not a factor that eliminates an organization from consideration. So definitely tell us what your indirect expenses are and what your overhead is. So we also look for this app for the project to serve and to target our target populations. We have two very broad topics, the poor and the working poor, which are defined as under 250% of poverty, the uninsured and the underinsured, and we recognize that this definition has been changing with the implementation of Covered California, but still we are looking at the underinsured and uninsured, as well as two specific target populations of the homeless and children. Now, we're not looking for you to specifically serve them. If what you're doing is serving the poor and the working poor and none of them are children or homeless, that's fine as well. Just looking to target at least one of these four populations, preferably more than one of them. We also, one of the other things that we look to do is we try to get to actual numbers and preferably unduplicated numbers. We recognize that you might not capture this information, but we do want you to give us your best estimate if that's the case. In each of the categories, we will ask you to talk about the demographics about the people that you're serving. The total number of people served, again, should be the unduplicated number, even if you have to estimate. We do look to see which area of the two-county area that you're serving. Specifically in San Diego County or in Imperial County. It helps us to understand both the breadth and the depth of the services that you're providing. The breadth being how far across the county are you serving, whichever county you're serving or both counties, and then how deep into that area. So you might be serving all of San Diego County but not going very deep. You might be serving in just, say, East San Diego County, but you're going very deep. So that would make a difference as we're looking at what impact this particular project is having. Again, it's not something that eliminates anything or gives one area a stronger preference, but it is something that we like to know in order to understand impact. This is probably the 8 questions I'm going to go through next are probably the most important part of the application, and they follow very closely to a business plan. You're going to want to try to address these questions as much as you can with backup data and supports. The first one is to be able to state your problem. In our previous grantees, they might have identified the problem as adherence to medication in order to effectively cure disease. It was sometimes connecting social service information to medical information to provide for a complete picture. Text for Babies was healthy messages for pregnant women and the like. So try to tell us what is the problem you're seeing out there in the community that you're trying to solve. And do you have data to back up your statements that you know it's a problem, or is it anecdotal because of what you're seeing with the people that you serve? This is probably the only place where a very brief, compelling story might be useful, because we're looking to see what is the value proposition for the people you're trying to serve. Why do they need this particular service or project or product? The next question talks about the project overview. It begins to address your solution to the problem that you just identified. Why will your project make a difference? Be able to speak to the impact of your solution and what you hope to accomplish. Why you, or why your organization? Why will people come to your organization for this particular service or product, whatever it is that you're creating here? It's really great if you can do a market analysis. I know that that's very time consuming, and we don't expect that you've done a complete and thorough market analysis, but you should have some idea of what the demand for your service is, what are the trends in your proposed market. What percentage of that proposed market do you think you'll actually reach in this 3-year period of time? The other question is also whether or not you know your competition. If you create this, who will your competition be at that point? The third question deals with the key elements of innovation. What qualifies this as innovative and how it advances health and wellness? What's so different about what you are proposing? Sometimes we see creative uses of current products or programs, but what is innovative about yours? How is it really different? Again, I can go back to the Dr. Jeffrey Brenner story I just told, where he took the Medicaid data and honed it into the primary areas, creating the most cost of care in the emergency room. So it doesn't necessarily need to use technology, so don't add a piece of technology in there just because you think it needs to have technology. The fourth question has to do with the composition and structure of your innovation. This is where you really need to know your metrics and analytics. How do you answer the key elements that we're looking for regarding reducing costs, improving quality, and increasing capacity? In other words, how are you going to move the needle, and how will you know that you've done so? At full implementation, why will this even matter? How will this impact the long-term success of a community to advance their health and wellness? You'll see in many of our projects that sometimes it really has a broader impact immediately. Sometimes that impact might not happen until later on. The example I'd use is with Access Youth Academy, where on the surface it looks like a squash program taking kids to college. But what we really were interested in is looking at the social determinants of health, knowing that if somebody goes to college, the likelihood that their children go to college is much greater and greatly increased, and therefore we could see that there could be a network effect of impacting this community in generations to come. So you may not be able to show it in the first 3 years. That certainly wasn't going to happen with Access Youth Academy, but we did hope to see that happen, at least begin to see how it could happen because of the success of that program. In the fifth question, you're going to be asking, okay, this is really about project leadership and your leadership team. It may or may not be your CEO. It may be the entire team of people that you've brought together to try and move your project forward. But the leadership are the people who are really acting as the champion within the organization and potentially outside of the organization. They are the people or the person who keeps everyone motivated and sees the end goal and guides everyone to it. How do you, in words, convince us that your leadership sees this project as tops over all other priorities? I've seen the passion of the leader be the factor that tilted the decision towards one program because the board was convinced that that person would never let it fail. But also, thinking about that, what are the skill sets you need to make this project successful? If you're going to use some technology and you say you're going to develop an app, do you have somebody on board that knows how to develop that app? Or are you going to build it into your project saying that you're going to look for and find the most qualified app developer in our community, or in the most effective app developer overall? Are you putting a product out there for retail marketing? Who has the expertise on your team to do that? If you don't have it on board now, how will you add it and at what point? For example, our project Solutions for Change had a knowledgeable aquaponics person on staff when they presented their proposal, but as they got into the actual expansion of the aquaponics farm, they added a world-renowned aquaponics expert to the team, which really helped them to maximize produce production as well as distribution. The next question has to do with the outline of a sustainability plan. This is probably one of the hardest areas and one that we still continue to want to see come forward just stronger in the presentation. Because, as I said, there's no new money coming into the field, there are only more people. So how are you going to measure your progress? How do you know that you're going to be on track? What will you do after the 3 years in order to keep the project going? If you don't have additional philanthropic dollars, what will keep this project going? And as we talk about the budget in just a minute, we want to see the real cost of the project. If the real cost is over $1 million, how are you going to obtain the additional funds in order to complete the project? So there's a lot that's in this, and it's important that you're beginning to look at what the sustainability plan will look like, from startup costs to your break-even estimates, at what point you see yourselves being to be at a break-even point, and then what happens beyond this particular grant and how you continue the project. The next is plan to scale the project. Many times in these kinds of projects, you want to start out small. You want to like test it, be able to tweak it, be able to really fine-tune it before you actually put it out farther. And so what are those kinds of milestones and time frames that you see will allow you to roll it out over time? How do you see your project actually scaling up or growing with success? Sometimes it may be within your field of work that you're doing. Sometimes that expansion may be from one community to the next. Sometimes that expansion could be county-wide, or it could even have the potential to go international if you really thought big about it. But that may not be your goal in terms of this particular project, but just looking at what those things might be. It's also a challenge to begin to look at your exit strategy. How will you know you're actually on track? Then how will you know that to say, we have to pull the plug on this? And that hasn't happened very often, but I can tell you that with all of our innovation initiatives, we've had challenges along the way. Some of them were unforeseen. Some of them could be predicted and were actually in the proposal, and so we were expecting that they could happen, and we knew kind of what we wanted to do or needed to do in order to address those challenges. The last question that you'll see is about the budget. There is, uploading your budget, that kind of thing, but I want to be able to stress to you to actually look at the true budget. Even though this is a $1 million project, we want to know what the costs are, what is it that we're getting into in the long haul. There have been a couple of projects where we've extended additional funding to. The Community Information Exchange is one of those. It's our largest funded project to date at $2.5 million. But we don't want to go into this thinking that we're seen as the sole funder. We want to know that if this project is so great and wonderful, that there are going to be others that come on board. So what is your plan to be able to secure those additional funds, and how will you continue that project? So we're really looking for a true budget. And, so just hoping that you'll give us that actual estimate and to be honest with us about what those costs are. This is a slide that gives you an idea of the different projects that we have. I can tell you that this is a very different way of presenting projects for funding. If you're selected as one of the 4 or 5 projects to go forward and to go before the board, you will work with our consultant. Every year he tells me that in the first meeting when he asks about your project, pretty much everyone takes about an hour and a half to tell him. And then he says you're going to have to boil it down to 15 minutes. At this point, you'll know that you've already aligned with our heart. As I mentioned earlier, there's one place where it makes sense for you to tell a compelling story. But beyond that, you really need to tell us and convince us that this investment is the right one. We want to know that the business model is sound, that it has potential beyond our funding, and most important, that it will improve the health and wellness of one of our target populations, if not more than one. I hope this slideshow shows you the variety of projects that we have funded over the years. Please feel free to go to our website to learn more about them. The recording of the presentations on April 6th when we launched our innovation initiative should be on the website soon if they're not already there. And that way you can learn a little bit more about where they are now in their progress. So I'm wondering if we're going to see your logo up there next year when I'm doing this presentation. And I challenge you to think about, if you had $1 million, what would you do to advance health and wellness in either San Diego or Imperial counties, both or even beyond that? Then, whoops, sorry about that. Some of the important dates for you to know and to remember is that the deadline for submitting your application is on May the 11th. The program committee will make the selections of the top 4 or 5 that they want to go forward on May the 27th. The Pitch Fest and the board decision is on July 15th. In the years that I've been working with the board, there's only been 1 year that they did not make their decision on the date of the Pitch Fest, so it's very highly likely that they will make that decision on that Friday, July the 15th. and we make announcements soon thereafter. So I'll open this up now. If you've muted your phone, go ahead and unmute it and let me know if you have any questions at this point about any of the information that I've presented. Or you can also do it on the chat. Don't forget, if you are trying to ask a question, that you might be on mute, so you might want to unmute your phone.
Nancy, this is Sean Mahoney with 0800. Can you hear me?
Hi, yes, I can, Sean.
Hey, I'm sure I could find this online, but since you asked for a question, I'll throw it out there. The $1 million, is that does that have to be budgeted to be spent within a year, or is it over several years?
You know, that's a great question, Sean. Thank you. Most of the projects have spread this out over several years. As I said, we try to get to full implementation by the 3rd year. And so we've had a couple that have been 2 years. Most of them have been 3 years. So it's really looking at how you spread those dollars to get to that full implementation.
Okay, thank you.
And Sean, also, and for all of you, also, once this project is awarded, I work with the person or the organization or the collaboration to set those guidelines and to set those milestones that are going to be achieved throughout the course of however many years it takes. So we sit down and really fine-tune that. What we want to see is just how are you planning to budget the dollars at this point.
Great, thanks.
Thank you. Are there any other questions? Please know that I'm available. This is a really important project. I am available to talk with you. I have many times talked through projects with people. You can contact me by email. You can call me as well. It's great to be able to set up a time and just listen to your project. Many times I've been able to help people understand like where they need to strengthen a particular project description or where there might be something missing, and just really talk you through what might be important in this particular proposal that I know the board would be looking for. I'm getting much better at anticipating many of their questions. I can't anticipate all of them, that's for sure, but I think that I've got a good feel for what they're looking for. So please use me, please email me. Don't worry that you think that I'm too busy, because I really think that it's been helpful for other proposals to have had a chance to talk with me about what they're thinking about. So I do hope that you will either email or call me and that we'll find a time to talk about what you're thinking about. So with that, I will end the, oh, whoops, sorry, I do have a question on the chat, so let me look at it. Thank you. I'm glad you saw this as a very useful presentation. Can this funding be partly used to purchase a facility for the purpose of the grant? Unfortunately not. We don't use any of our funds for capital projects, and that has been a function of a couple of projects in the past, but funds cannot go for a facility. You can also find some of these guidelines, not some of them, you can also find these guidelines on the website in terms of the things that we don't fund. But good question, thank you. Are there any other questions? Great. Well, seeing no other questions, I'll go ahead and end the webinar. Please, again, feel free, and I hope to really strongly encourage you to get in touch with me if you have an idea that you're thinking about to submit as a proposal. Thank you again for joining us.